Hello, this is Shirley Gutkowski, and I am going to be presenting some information that will help you as a dental hygienist get in between your patients and their needing to make a decision on some kind of a filling material. I would like to thank the International Academy of Oral Medicine and Toxicology for my most recent designation as a biological dental hygienist. Thank you for offering that as an option for dental hygienists to be certified in biological dental hygiene. And we're going to be talking about what the dental hygienist's role is in mercury-free dentistry. Why is it that we wait until there's a hole in a tooth and then ask a patient what it is they'd like to have to fill it when we can do so much more? This is driven by my understanding of what's been going on with the Consumers for Dental Choice group, which is a group that is asking whether we need mercury at all, and isn't it time we got rid of it? We're going to be talking about biomimetics in the whole environment with the big WHOLE, including a little of epigenetics, a little bit about the structures and biofilm so that we can get a real handle on what's been happening and what we can do, what we as dental hygienists can access and solve these problems. We have to look backwards first because this is a problem that has had poor solutions for over 100 years. This is a quote from Dr. Evangeline Jordan in her book that was published in 1925 on operative dentistry for children. And she talks about not filling teeth, but preserving the necessity for filling teeth as the dentist's true work, and not this tiresome, painful plugging of holes. And she wondered, why is our profession permitting 60% to suffer needlessly? That was 120 in 1925. So when she wrote the book, it was probably 1920. This is from the Weston A. Price Foundation website about a case or an observation, or it wasn't actually a study, but it was talking about health and how children especially were getting dental decay, and they were observing and making note that these children's decay arrested and stopped growing. I guess it's a little bit redundant once their diabetes was under control. So this gives us some food for thought about this idea as diabetes being a systemic condition being expressed as a dental condition, and the two should never be separated. We don't really talk about anything but sugar when we're talking about children with early childhood caries. And we just keep placing, traditional dentistry, placing the stainless steel crowns and providing really aggressive surgery for those children when really it's a systemic condition being expressed as a dental condition. This was first brought to my attention in this paper by Dr. Hugh Joel from 2009, and he talked about these two researchers and two book authors from the 1970s, Clive and Yudkin, who were pointing to sugar as being the root cause for all diseases, and that until we got rid of sugars, we were never going to be able to solve the problem of health and health care, or what do I want to say? Not even health care, sick care, until we start looking at the sugar and the amount of carbohydrate consumption we were doing. So Clive and Yudkin both were expressing this idea of the fermentable carbohydrates as leading to disease, and it was about the same time that Ansel Keys was really pushing for this idea of this lipid hypothesis that excessive dietary lipid intake caused systemic diseases. Now, there are a lot of people, especially recently, who are looking at this hypothesis and just the word lipid hypothesis and trying to prove it. And what they found is that it is improvable. The lipid hypothesis for coronary artery disease or any other disease has not been proven at all. So we really have to step back again and take a look at what was going on at the time and what we can glean from it and what we can use today. Dr. Yudkin's book was originally published in 1972, and it was reprinted again in 2013 with a foreword from Dr. Robert Lustig of Sugar the Bitter Truth fame. Dr. Clive also talked about these terrible conditions that were all brought out by what he called the saccharine diseases and the taking of refined carbohydrates. Dr. Hugh Joel pointed out that at the time, in the 70s, dental diseases were just such a, I don't know where the dentists were at that time. They should have been louder, but I don't know, the whole thing, when you read some of these books about what was going on at the time, it was just shady and shifty. So what was happening back in the 70s is they're like, well, dental decay, big deal. We've got fillings, so we can fix that. That's real obvious. But when we're talking about cardiovascular disease, we have no idea what's happening until someone dies. And that is very often the very first indication that there's any cardiovascular problem at all. So everything just went to the wayside with respect to dental problems. And in 2017, Dr. Hugh Joel again pointed out that those two researchers, Clive and Yudkin, were calling for this focus on carbohydrates and sugars, and that dental decay and periodontal disease were warning signs of systemic diseases. And this just makes me wonder, why did vets figure this out? Why did veterinarians understand this, and why were they able to look at our dogs and lift their lips and say, oh, his gums are pink, his cardiovascular diseases, or his cardiovascular system is healthy? And it just took, I don't know, it just took forever. It just takes everything way too long. When we really look back and look at prehistoric times, we see that nutritional diseases were sparse, and that dental diseases were also sparse, and that dental decay didn't start to show up until we started to see this shift in our diet, in the human diet, to be more grain-based, to be more available as troops of people started to live together, and they started to build a commerce where one person would grow the whatever food, and then the other people would provide other benefits to the community. And that's when we started to see these dental changes happening. And today, when we try to look back at that, we're like, oh, they ate a bunch of vegetables and blah, 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 and they were all great. We see that adults from the early Neolithic sample bore the highest number of cavities. This is where the diet were changing to be less hunted and more gathered. Meat and dairy products became more and more important, which had a positive impact on dental health. And in this study here, they inferred that increased reliance on wild plants rich in fermentable carbohydrates and changes in food processing caused an early shift towards a disease-associated oral microbiota in this population. These are bits of information that we can exploit today in our practices. And we need to look at our patients' overall health and really understand that it's not just about vegetables. We need the four squares. We need to get meat and animal fats back into the diet. Dr. Ansel Keys died at 100. He looked like that near the end of his life. And Jack LaLanne, who was a true omnivore, he ate a variety of foods and he avoided carbohydrates and sugars that, well, except maybe for fructose. But he had a variety of foods in his diet, and he didn't just take one diet or one group of foods out of his diet. He died of pneumonia at the age of 96. He also avoided antibiotics, much to his detriment. So we've been trying to redefine nutrition for a long, long time, and I still don't think we're right on it. In the 1970s, the push towards grain and bread and multiple meals. Oh my gosh, I remember going to all of my diet classes. I've had a weight problem my whole life. And, you got to eat your bread, you got to eat your pasta, you got to eat your grains, you got to eat 6 times a day, you got to eat 6 small meals a day. And I'm telling you, somebody that's on a grain diet that's heavy in these kind of complex carbohydrates are never able to eat a small meal because they're hungry all the time. The fat is where the satiety comes from, which is why you can eat a whole bag of Doritos, which you can't eat, that much steak or meat chips, if you will. All of those changes in our diet have been impacting our DNA through an epigenetic change. When we eat the foods that we eat, and when we are into environments that are not conducive to health, DNA changes are made to the histones that kind of anchor the DNA. And the changes appear quite slowly, and then we just call them normal. When they are not normal, they are only common. This is a very good example. This is a slide from Dr. Kevin Boyd, pardon the French. He came across this book. Dr. Boyd is a pediatric dentist with a master's degree in human nutrition. He is also a visiting scholar at University of Pennsylvania in the anthropology division, and he has been studying skulls for the last probably 5 or 6 years. He's also gone across the globe to collections of skeletons and skulls, particularly of fetus and small children, and he's been doing measurements. And this part here is what kind of drove him there, I think, that these statements are now made as though they were fact when there is nothing to bear them out. That babies are born with a small degree of retrognathia, which helps them pass through the birth canal. He states emphatically that that is not true and that the chin is nowhere near the birthing process in the canal. So what he's been studying is this idea of retrognathia as a modern development based on epigenetic changes that have occurred because of nutrition and the environment. We can see these recessed chins already in the sonograms. I'm sure anybody that has a child or has a grandchild have seen these sonograms, and now that they're in 3D, you can really see how receded the chin is. The tongue size hasn't changed. This is a skeletal change. So where does the tongue supposed to live when the chin is that far back? It's extremely common. These are skulls from the pre-industrial age, and you can see that all of their chins are forward. None of them are recessed. And if we take an X-ray image of the skull on the far right and superimpose a modern infant, modern fetus, you can see that the chin angle is like enormously different. He has a lot of videos on YouTube. If you are not familiar with Dr. Kevin Boyd, I would strongly suggest that you seek him out on YouTube and listen to some of his videos. He also talks recently about nutrition acquisition. And I thought that was a real interesting term. And then I also heard Dr. Lustig talk about nutrition acquisition and how we've changed the way that we eat, the way that we take food in. Not only are we jockeying around with the times that we're eating and how much we're eating, but we're also messing around with the way that the food is delivered to us. So I wanted to take just a minute out here. This is a screenshot of Dr. Jason Fung's lecture to what is it called? CrossFit. Last year in 2019 here in Madison. And he talks about today's modern eating pattern. I was having trouble finding this actual reference, so I decided I would take a screenshot and just share with you that this is what Dr. Jason Fung presented. And if you have better luck finding this original research, you can. But I've seen this myself through all the diet classes that I've had to take over my lifetime. That when I was a kid, you came home from school, there was no snacks. You had to wait till dinner. If you didn't eat a good lunch at school, well, that's just too bad. You didn't have snacks throughout the day. You maybe would have had snacks, watching TV at the end of the day. But even that was not an everyday occurrence. It was like a special deal. So today, though, the highest number of eating occurrences or occasions in the top eaters is 10 times a day, almost 11 times a day. Eating late is extremely common. 37% of calories are consumed after 6 p.m. So when we talk about health, that's one thing. But let's just shift that and put this information under dental, in the dental category. When are the teeth supposed to recover from eating? Especially if we are eating multiple meals of carbohydrates. When is the saliva going to have a chance to heal those teeth and heal the enamel? When are you supposed to brush your teeth? You always have food in there. So this is something that dental hygienists can address in the dental chair that is past just your whining, brushing, and flossing routine. We also have these highly, highly sugar-laden foods that are in pouches now. You don't even need a spoon anymore. You just have to squirt it in your mouth, or worse, suck it out. Just imagine the shape of your muscles of your cheeks and where's your tongue when you're sucking a bag like that and trying to get out some nutrients. My own naturopath was very surprised to learn how detrimental these were when I pointed them out. She was just so thrilled that her child was easy to eat some vegetables in the car without a big mess. These are horrible. These are horrible for the development of the face. And if you just think about how many, not added sugars, just sugars that are in these pouches is just unbelievable. And it doesn't get better when we grow up either. Nobody's chewing their food anymore. Nutrition acquisition comes from sucking. And those changes are also being made on the histones, on the DNA, so that we have these skeletal and muscular changes as our future generations continue to change. We don't know the difference today between food and something to eat. None of this on this picture is food. It's all just something to eat. Why? Why are we so quick to eat? We're just pounding our day full of so many things that we don't have time to cook our food. We already don't have to pound our laundry on a rock. We already don't have to go out and kill our own food. We have enormous number of time-saving things around us, but we still don't take the time to feed ourselves properly. Dr. Mike Mew has found this to be such a big deal that he asks his 4-year-old orthodontic patients before they do anything to chew gum for an hour a day. And I would encourage you to also talk about that with your patients who really do want to drink their salad, that they need to start chewing gum to increase the muscle tone of all of the muscles of mastication, the tongue, the masseter, the buccinator, the orbicularis oris, and all the secondary muscles, the temporalis, all of that stuff. Those muscles need to be toned and healthful in order for your patient to be toned and healthful. You can't even clean your mouth out if the muscles of mastication are not in tone. Sugar clearance times goes really quickly when you're chewing gum, really quickly. So you're getting good facial growth in the child, and you're also getting better muscle tone and sugar clearance times in your adult patients. And we also know that this is another big problem that's coming up: obstructive sleep apnea in children. Who knew that could be a thing? And we know today that that is a role of oral facial growth. It is not just to do with weight. If the child's face isn't growing, you are missing out, or they are missing out on good sleep, as the soft tissue continues to grow and the hard tissue does not. The epigenetic story was really became important to me after this lecture here. Why are grandmothers important? On YouTube from the University of California Television. And this doctor, I want to call her Dr. Davis, but I don't think that's right. Dr. Baker, Dr. Diane Baker, did a really nice job of laying out this whole story of how epigenetic changes occur almost skipping a generation. We also know that frequent snoring in adults, pregnant women, increases the preterm delivery risk. So now we have already generations of retrognathic chins. We've had generations of people with their teeth extracted and retrusive orthodontics applied. Their tongue is never where it's supposed to be. It doesn't have enough room to live there. And we are now creating a situation, those things are creating a situation that are damaging unborn children. So we need to really get on board with this epigenetic change. And we have to remember that it's mostly to do with the woman. Men have spermatogenesis that occurs every 2 months, or it occurs continuously, but it takes about 2 months to turn over. So if men were to start cleaning up their act, the sperm can be recovered. They can recover the genetic material, right? It can be demethylated. But for women, the changes or the environment that's occurring while that woman is a fetus, growing all the eggs she's ever going to have, it looks as though things skip a generation. So it's really critical that we get in with these little 12-year-old girls and start to really explain what is happening to their body and how best to use that body, because it has real consequences down the line. We can't just ignore everything until we're ready to have a baby and then just take folic acid and hope that's what we need to do. Just quitting smoking when you're 27, a year before you want to have a baby, and stopping drinking 6 months before is not going to make a difference, because we have to undo the stuff that happened from our grandparents. We have to get a good handle on this nutrition continuum for our patients to understand how to stop the decay so they never have to make a mercury filling decision ever again. We need to help them fix things from the bottom up. I created this nutrition continuum to show what happens to foods as we process them and how they eventually become toxic. Apple juice, which I fed gallons and gallons and gallons to my children, were like incredible. It's just a horrible, horrible, horrible thing. And an apple is fine. It's just when you start doing things to it or adding fats to the sugar in the apple. Plus, today's apples are also grown genetically modified to be sweeter and bigger. You used to be able to just carry an apple to school in your lunchbox. Now you need a separate lunchbox for the apple. It's so big. You can share it with 3 people. And then we have this whole thing, this whole eat the rainbow, this push and push and push to vegetable nutrition and what do I want to say? Just this awareness that vegetables have all of these different components that help the human body grow. And then, wait a minute, we don't have time to eat all of that, and we don't want to dirty a mixer, so why don't we just take a bunch of pills? It's unbelievable what's been going on with the supplement industry. Aside from it not being regulated, which I don't really care about, but it's that people are getting the idea that they can take plant parts as a nutritional supplement and get all the benefits of eating the actual food. This is not natural. This is not real. This is real. So this is a 2-year-old. Oopie. This is a 2-year-old. I don't think you're going to get the sound, but he is a snoring little maniac. He's 2 years old. I stole this from YouTube. He's struggling to breathe. You can hear the mucus in his sinuses when he does get a breath of air in through his nose. You can see the retrognathic chin, and you can see his nostrils are pointing straight out. He doesn't even have an actual nose where the nostrils are underneath. After the tonsils and adenoids are removed, he's still breathing with his mouth open. It's quieter, but his face is not going to grow correctly. We also know that mouth breathing decreases the oral pH, particularly during sleep. And in a low pH environment, you have a higher chance of creating an environment for cariogenic and periopathogens. So not only is that happening, not only is the breathing not happening appropriately, you are missing out on the ability to remove or reduce the biofilm that's occurring. We can look at our patient's nostrils. I remember learning about nostrils. I graduated from my program in 1986, and I have never used that in my clinical practice, the knowledge of the nostril size. If they're small, they're probably breathing through their mouth. And it completely depends on what kind of compensations they use that tells where the teeth are going to grow bad. All mouth breathers have some kind of malocclusion, and that it varies greatly, as you can see here, and it depends on the compensations that they gather. We also know that the sinuses don't grow in people that breathe through their mouth. So what are you going to do when you're 45 and you're really into health now and you want everything to get better because you hear that when you get to be 50, everything falls apart. You have the sinuses the size of a 12-year-old, and what are you going to do now? Temperature and sleep, with and without mouth breathing. In children, it's a causal factor for dental erosion and dental decay. Parents need to sneak in there and take little videos of their children sleeping. What are you going to do about that as a clinical dental hygienist? You're going to do a couple of things. You need to get yourself involved with a lactation consultant and build a good referral network with that person, and also develop a relationship with a local or an internet orofacial myofunctional therapist so that we can get these kids to sleep with their mouths shut. Mouth breathing also affects chewing efficiency, speaking of nutrition acquisition. It takes longer to chew, and then what happens? If it takes too long to chew, people are going to start choosing foods that don't require a lot of chewing. Once that happens, they just scoop their food and they just throw it right down the chute. We had a little boy the other day show us how he was eating gummy bears. He did not bite a gummy bear at all. It just slipped right down. His mother says that everything he eats goes like that. Tongue tie. Yes, you're seeing more tongue tie. No, it's not being overdiagnosed. It has always been underdiagnosed. We see more because it's of the epigenetic changes that have occurred over time. We have apoptosis that is malfunctioning in many of these children. And we're finding that this is a real reason why adults have sleep apnea. And we can help them by getting rid of this tongue tie. If you're not doing tongue ties in your practice, I would encourage you to talk about that with your doctor. The people that have tongue ties need to have their tongue prehabilitated before the release and rehabilitated after the release. So it is quite an ordeal. The older the person is, the more it's going to take with respect to myofunctional therapy. And then, there's no proof, we need evidence-based. We can't wait for evidence-based right now. We can't wait for enough studies to show up. We have to remember that evidence-based includes the practitioner and the patient's experience. This is a little screenshot from a Facebook conversation about a child who's grinding his teeth. And the second mother commented back that her middle son ground his teeth before he had his tongue tie revised. And it stopped immediately after. This is evidence. We have to remember that Dr. Schimmelweis, the guy who invented hand washing, couldn't get anybody to believe him either. He thought they all thought he was crazy. And he was like, no, I'm not crazy. And they were all standing around with their arms folded going, where's the evidence? Where's the evidence? So we have to be cognizant of that, and we need to be more aware. We need to be aware that eating real food might be the answer, and that some of the real food might be at grocery stores, and sometimes you have to grow it yourself. And that all diets start with the same concept, that you should stop all processed foods and that you should eat clean. This is where we're at. We're back at 1970. We're back looking at nutrition with new glasses. And we're understanding that the carbohydrate push has been detrimental. And we have to also look at the fats and oils that we're eating. That's a whole separate issue that we'll save for another day. Remember that epigenetics changes the face, the mouth, Mouth breathing controls or changes oral pH, and chewing needs to be reissued, needs to be re-emphasized. And then when we're talking about sugar and talking about diet and we're talking about changes to the diet, people really are wondering if they should stop eating fruit because it has sugar. And I would have to say maybe so. In nature, fruit becomes available at the end of summer just in time to fatten up the people so that they can survive a really drastic winter. Just think about it that way. What are the ancestors of that person who's wondering? Where did they come from? From the north? They should probably never eat a banana. If they're from the south, you have a little bit more leeway. Maybe the southern people shouldn't, along the equator, that kind of south, maybe they should never eat berries. You know? We've also lost, this is a big piece of news that nobody talks about, we've lost an enzyme that we used to use to break down fructose. So if we don't have enough of this enzyme, which we don't, we can't break down the fructose as far as we used to. We didn't need to. And now here we sit without our uricase and plenty of fruits. Dr. Lustig calls sugar the alcohol of the child, that he, in his practice, is seeing children as young as 6 and 8 months old with fatty liver disease, non-alcohol fatty liver disease. It's nuts. He also was reporting at a recent Academy of Applied Myofunctional Sciences meeting that they now are finding fructose in breast milk, which has never happened before. But they're finding it in women who drink these 20-ounce drinks with high fructose in them, high fructose corn syrup. So here we are. Dr. Weston Price, a dentist, found all of these things already in the 1930s. We don't even have to go to 1970. We can go all the way back to 1930. He went around the world and he brought up all of these, sequestered communities that were easier to find then than now. And he was able to detect changes in caries rate and facial development once the foods were coming in, foods of commerce is what he called them. He found that those tribes that ate ancestral foods within their circle were all healthy. Whatever foods were local for them, for that tribe, that's what they ate, and that's what kept them healthy. We have to know that dental decay materializes due to a myriad of conditions, structural, biological, and chemical, all which must be addressed. We have this whole big cluster here of things that occur to get dental decay, but all of that is encompassed in nutrition. And I had to create this whole little thing by myself because all nutrition pictures only show vegetables, fruits and vegetables. They almost never show animal products, and without animal products, we're merely missing the boat. We can classify ways to approach dental decay. Topical applications to make the enamel more resistant. Hydroxyapatite, nanohydroxyapatite, CPP, ACP, other products like that. We can improve the diet, and we also have biofilm killers and destroyers that can be very helpful. So we've all been kind of inundated with the biofilm story for the last 20 years. Nobody's still acting on it. You can't just brush and floss it away. There are other things that you can do. We can get to the earliest colonizers. Biofilms grow in a predictable way with predictable bacteria being invited into the biofilm at predictable times. We know that sugar really kind of amps up the biofilm. It grows faster. It has a lower pH right at the interface with the tooth. We can brush it away and floss it away. Those things are true, but we also have other options. We can get to it before we start to see the problems with it. We don't have to wait for inflammation. We don't have to wait for dental decay to materialize. We can get to it earlier. The nutrition piece is critical and needs to be addressed, but that takes time, like a serious amount of time to manifest itself. So we do need to still work with some topical things to help remove the early pieces, the early decay, let's say it that way. This is the Canberra model, which is still accurate. I talked to maybe I emailed with him, Dr. Featherstone, a few years ago, and I said, maybe we need to start putting these structural components in. And of course, what did he say? We need more proof. I'm like, okay. So I just created my own little graphic here. We need to be focusing on the big picture, not just the little picture. We have chlorhexidine varnish. We don't need any compliance. It kills the bacteria for months and months after. That would be a really easy way to go about it. We have chewing gum with ingredients. We talked about the importance of chewing. Chewing gum is a really important adjunct, and there are some really good ingredients that we can use to put into the gum to either modify the biofilm or make it more difficult for the biofilm to materialize or mature. This is magnolia bark. You don't see this very often in chewing gums, but you can find it. Fights against oral cancer. It's a good phytochemical. And it busts up a biofilm. And then stuff like this happens. You know, you can only make so many claims. But we can ask our patients to chew gum. Just chewing sugarless gum with no active ingredient can help reduce dental decay. So we need to ask our patients to chew their gum. It adjusts oral pH to safe levels. It increases facial muscle tone, decreases sugar clearance time, improves concentration, and may even improve weight loss attempts. We also can look at some of these dried fruits, which most dentists and dental hygienists hate. I do a lot of work with Dr. John Peldiak from Clear, and every time I bring this up, he just cringes because of the sugar content, the concentrated sugar in dried fruits. That's true, but the sugar clearance time is very fast, and the plant material that's in those dried fruits is an anti-biofilm component. Subjects with high level of mutans had significantly longer clearance times than subjects with a low level. Flavonoids in those fruits and vegetables can help remineralize enamel or root surface caries. This was a study that looked at 1,000 parts per million fluoride, which is the gold standard, the CPP, ACP, along with the proanthocyanidins and the a little bit of fluoride, and found that microhardness was improved dramatically more with the proanthocyanidins with the CPP ACP, which is the recaldent. Here's the thing. Sometimes we need a little boost. If it's between, asking them to brush better and longer and all this other stuff, and waiting for their diet to kick in, or adding something surface like this, I think we can all agree. I think that we can all agree that adding a little topical, I think we can all agree that oral hygiene has pretty much done whatever it can do. Obviously, if the kid is 11 or 14 and they're still not cleaning their teeth well, oral hygiene is appropriate. Oral hygiene steps with brushing and flossing. But let's remember that our super old ancestors before clothes didn't brush their teeth. They just ate really hard foods, and they ate really dense foods that required a lot of chewing. They had time between the foods that they ate, and that they weren't reliant on just brushing and flossing. Let's remember that vitamin D deficiency can be a problem. It's a huge issue in general, but vitamin D supplementation, including in breastfeeding, should be part of our armamentarium. And when we're talking about breastfeeding, let's just ask how it's going. Let's make sure that our mothers are not iron deficient or vitamin D deficient, that they're supplementing with those fat soluble vitamins, because their infant is only getting breast milk. And breast milk is very high in fat, and it needs to have all of the fat soluble vitamins included in there, in the breast milk. Let's make use of our biofilm modifiers that come from plants. Let's make sure that we understand that biofilm starts with early colonizers, and then over time, these colonizers attract other bacteria into the biofilm. And most of our biofilm modifiers are attracted to or have an effect on these middle to late colonizers. So we need to really think about our way through a biofilm, and that xylitol is one of the things, and it's probably the easiest to use, that affects those earliest colonizers. Why mess around when we can just wipe out the entire pathological biofilm by eliminating those early colonizers and making it difficult for them to stick onto the tissue and make it harder for other bacteria to be invited into that biofilm? Xylitol and erythritol are right up in there. Cranberry, blueberry, licorice root, and lactoferrin all act that way. Xylitol has some really unique benefits that are pretty much medicinal. You can find a lot of studies on the benefits of ingesting xylitol. This one here is looking at pneumococcal sepsis for rats. The rats were on a xylitol diet for 2 weeks and then inoculated with the pneumococcal bacteria, and those that were on the highest xylitol diet survived the longest. So, we're getting some really good benefits from xylitol, not just bacteria on the teeth. It has oxidative killing of bacteria and neutrophilic leukocytes on top of that. And there's a lot of discussion about the gut microbiome. Nobody knows anything about the gut microbiome, just so you know. It's all a crapshoot. We know that it needs to be diverse. We know that certain players are bad players, but xylitol acts as a prebiotic for the good bacteria in the gut. It's been studied in a lot of different ways in the GI tract, including the benefits of using xylitol ingested for kids with autism, and how it changes and benefits the autistic people. So that's by Dr. Mark Cannon, and he's been doing some really amazing things looking at xylitol. and kids with autism and the gut microbiome. You can see this was also a paper, I think this is from the same paper, that looks at the different bacterial groups that are decreased when xylitol is ingested. Look at that right there in the middle. C. difficile is reduced in those people who are ingesting xylitol. So we're doing really good when we're using xylitol. It has like a magical component still. In the upper left there, you'll see erythritol is also improving the microbiome in the gut. So improving nutrition is critical. But sometimes we just need to do some surface stuff. And as we mentioned, xylitol is one of those. In the dental practice and at home, we can use xylitol or ozone water. We can syringe it into the pockets. We can run the water through all of our water systems, including the air-water syringe, the ultrasonic and sonic scalers. All of that stuff should all have ozonated, fresh ozonated water going through it. There are no studies to show any ozone treatment having any improper side effects other than coughing episodes, and that is with the gas. There are no deaths reported. Especially with dental ozone, we have an incredibly long safety record, millions of treatments, and very close to zero side effects. If you've not used ozone gas in your office, the coughing subsides pretty quickly, and it's very manageable using a vitamin C supplement. Usually people use like Emergency in some water and ask their patients to drink it. This is the exposure risk is very low, and we are very easily within the EPA standards for safety with ozone. Ozone oil is also really effective. So the ozonated oils are really to be purchased already made. A lot of dentists are trying to create ozonated oils in their own practices. It is extremely flammable and volatile. The dental practices that I know who started doing this 15 years ago all at least had 2 explosions and or fires before they gave up on it. So find a reputable source like ozoneoils.com to get your ozonated oils from. It's already done. They have a bunch of different products that contain ozonated oils, including soaps and deodorants. So you have a lot of different ways to use the oils. If you want to use the oils directly on your patients, it's amazing. You can put it into implant sites. You can put it on your instruments as you're instrumentating. For our perio patients, if we use a small syringe with a big cannula on there, we can just add the oil right into the pocket. It reduces the sensitivity almost immediately, and you can remove the calculus pretty easily. It does denature calculus, so over time it does, and not too long a time, makes it easier for calculus to be removed. And let's remember that amputating parts of the teeth doesn't stop the infection, and that we have ways to reduce the biofilm so that our patients won't need to make a decision about what kind of a product they need to fill the holes in their teeth. This is an example of a true restoration. This was a study done by Clear, and 5, I think, hygienists were asked to ask their patients to use xylitol 5 times a day for a month. You can see the picture there on the right has disclosing solution on the lower anterior teeth. That mouth is restored at a biological level. This person has had many fillings, many prosthetics, crowns and bridges, all kinds of different materials to help. I don't know what they were trying to do, but they weren't working at a level that is acceptable, because you still were getting holes in the teeth, right? That person is obviously older than 14. You can't just keep telling these people how to brush. We have to give them better options. This lesion was restored using topical applications of nanohydroxyapatite. So we can do restorations from the dental hygiene chair. Everything else is a prosthetic. And I can't tell you how many thousands of throats I looked at in my clinical dental hygiene career and never once saw an airway until 2014. Let me help you. It's not a throat, it's an airway. And if you can't see it because the tongue is in the way, it's a problem. So as we started out in the 1920s, we can end in the 1920s with this quote from Dr. Mayo in a presentation to the American Dental Association, that dentists should know much about the practice of medicine as a whole, and conversely, all physicians should know more about dentistry, its importance and possibilities. Let's get on board with the World Dental Federation, who wanted to eradicate dental caries by the year 2020. They had the only tool in their toolbox to eradicate it was fluoride. That was it. This is a 20-year goal, and it was not realized at all. The dental hygienist's role in a mercury-free dental practice is the heart and soul. The dentists do still have to hold the drill, but we as dental hygienists need to stop talking about sugar. We need to offer long and short-term solutions, and we need to be more cognizant of our patients in general. Thank you to the Dental Choice, Consumers for Dental Choice, to the American Academy of Oral Medicine and Toxicology for my certification as a biological dental hygienist. If you have not done that, I would strongly encourage you to do it. And this is another little quote that I think is very apropos. It is difficult to get a man to understand something when his salary depends on his not understanding it. We bump into that all the time. My name is Shirley Gutkowski. I am the owner of Primal Air, Orofacial Myofunctional Therapy, and Breathing Retraining. I would let you know that we see patients in our office, and we also see patients worldwide through the magic of the internet. You can reach me at primalair.com, our website, or at primalairOMT@gmail.com if you'd like to talk more about referring your patients right to our office. We would be happy to talk with you about how easy it is to refer patients there.